For me, just hearing the name Camelot conjures up thoughts of adventure, fanciful tales of King Arthur and his Knights of the Round Table, and that musical, of course. Today, we head to a different Camelot, specifically Camelot Island in the Thousand Islands National Park. This Camelot is real, and so are the adventures to be had there. We explore the island through the eyes of a curious kid on today's Story of the Day.
Support for Story of the Day comes from Clarkson University, offering over 95 programs of study with campuses in the Hudson Valley, Central, and Northern New York. More at clarkson.edu.
Hi, I'm Kara Chapman. It's Friday, August 22nd. Up first, in the months leading up to the passage of President Donald Trump's policy and spending bill, a group of hundreds of local doctors and medical leaders created the Healthcare Coalition for the North Country. They were concerned about how changes to the Medicaid program could affect the delicate rural healthcare system here. About a third of the region's population is on Medicaid. Their initial goal was to convince lawmakers not to make cuts, but those cuts happened to the tune of $1 trillion over the next 10 years. Now, the group is trying to figure out what it can do to minimize the negative impacts of those cuts. Amy Feiereisel reports.
Last week, over 70 doctors and healthcare leaders met over Zoom to talk about what the North Country will look like once steep cuts to Medicaid start to take effect. Lori Lanphier is the executive director at the Health Home Coalition. It provides care management for the state's most complex Medicaid recipients.
We know rural health care will be hit harder than any other spots in the country, in the state, with these cuts that are in the process of being implemented.
Those cuts include the expiration of healthcare subsidies used by many middle-income New Yorkers and reduced funding for Medicaid at the state level. They also include a new work requirement. It says adults on Medicaid who aren't disabled or have young children will have to prove every 6 months that they're working, volunteering, or going to school for 20 hours a week. Lanphier's organization serves some of the people the work requirement would kick off Medicaid, and she says they're scared.
Our care managers are hearing desperation of, I'm going to lose my benefits. What can I do? I'm ill. I have all of these needs. I have a medically complex child, a child with significant behavioral health needs. I'm on hospice. I'm terminally ill.
Republicans say the work requirement will remove, quote, waste and abuse in the Medicaid system. Democrats say the real goal is to kick people off the rolls through red tape. The work requirement will start in January of 2027, after the midterm elections. The need for resources and education was something a lot of members brought up. Kate Roos is on the Social Services Committee of St. Mary's Parish in Glens Falls.
I work with many people who are on Medicaid, who don't have any idea, never watch the news, totally confused about health care.
She says people like her can help get information out, if they have it.
So that when I'm talking to people who need support, I can send them to the right person for that advice.
Federal data from KFF, a national health policy organization, shows that about 70% of adults enrolled in Medicaid are working, but that won't exempt them from having to fill out biannual paperwork for the work requirement. For many advocates, a big concern is that people will lose coverage not because they're ineligible, but because they struggle to fill out the paperwork or do it wrong.
Most Medicaid beneficiaries work or did work, and we have extraordinarily low unemployment rates in at least Essex and Franklin counties.
That's Jeannie Cross. She's a former hospital trustee of Adirondack Health and currently chairs the Age-Friendly Task Force in Keene in Essex County. She was in favor of an idea that was floated during the meeting, that the coalition could help Medicaid recipients to fill out their work requirement.
I just think that there's ways that we could help advise on making sure that people who are enrolled get to stay there and make it as easy as possible for them.
What everyone in the coalition wants to avoid is a big uptick in the number of uninsured people in the region. The coalition has now formed working groups to focus on things like advocacy, education, and actual assistance to Medicaid recipients. It also wants to ensure people representing the region make it onto the New York Department of Health's new Medicaid Advisory Committee to make sure the North Country has a voice in the state response. Amy Feiereisel, North Country Public Radio.
When you think of the Thousand Islands, you might think more about boating and swimming than hiking. But on the Canadian side, there's public land on nearly 24 islands. They make up the Thousand Islands National Park. Many have hiking trails and camping spots. Emily Russell boated over to explore one of the public islands with her family and sent this audio postcard.
So we are out here on Camelot Island in the Thousand Islands. I'm here with my niece, Ada, who just turned 4 years old. And we're going on a hike.
Welcome to Camelot Island.
Woo! The trail here is less than a mile long, so it could be a quick hike. But if you're 4 years old and love to be outside, it's the perfect spot to explore. All right, just be careful with it.
Ada is very adventurous.
I like to find toads and walk and with Emmy.
She likes to find toads and walk with Emmy. That's me.
It's a beautiful summer day, a bit windy, which made the boat ride over a little choppy. But the trail here is in great shape, and it's so lush and green in the woods.
So, of course, many of the islands in the Thousand Islands are privately owned, but this is one that's public land, which is wonderful. And so there's a number of boats that are anchored just off the island, campsites around here, and this public hiking trail.
What do you see, Dawn? Let's go down here.
Ada leads her parents and me down a set of stairs. It takes us to a wide wooden dock that slopes down towards the water.
All right, so we're walking down the kayak launch here.
Whoa, so down. It's like a little path that you can walk in and play.
Yeah, it would be a good swimming spot because it's actually pretty deep here. This is nice.
Ada sits down on the edge of the dock and dips her little feet in the water.
What are you doing right now?
I'm kicking and I'm splashing.
The water this time of year is just perfect, cool enough to feel refreshing on a hot summer day. After she's all splashed out, Ada walks around the rocky shore a bit, just making sure there's no toads around here.
All right, should we continue on our hike? Maybe find some creatures?
We climb up the stairs and hop back on the trail.
Can you show me left, right?
Then I see something. 2 furry little creatures inside an old tree stump.
What? Look at that. What is it?
Always we call them caterpillars. They don't bite?
I don't know about these ones. Yeah, caterpillars.
One of the caterpillars has gray hair and yellow specks along its body.
Mommy, look. It's a caterpillar.
Another thing we spot along the trail are little red raspberries. I pluck one off a bush for Ada.
Is it ready?
Yep, it's a little raspberry we just picked. How does it taste?
Mmm.
Good? Good.
A nice Canadian man passes us along the trail. Ada fills him in on what we've been up to.
Yeah, I'm eating some raspberries.
What do you think about raspberries? Are they good?
Yeah.
Yeah.
Even when there are no tasty treats or little creatures to spot along the trail, Ada finds ways to entertain herself.
Whoa, you see that?
She jumps off little rocks and logs along the way.
Let's go jump here.
She falls behind and then sprints ahead. Her parents, my sister and brother-in-law, just had a baby about a month ago, so getting out of the house and getting some of Ada's energy out is crucial. After about an hour, we're back at the dock. We meet up with my brother-in-law, who's hiked ahead to get the boat ready.
How's the rest of it, Ada?
It was fantastic.
Good work. Ada, you want to sign out with me? All right. When I look at you, you're going to say your name. Ready? On Camelot Island in the Thousand Islands, I'm Emily Russell and
Ada
Ada Minearth for North Country Public Radio.
Ada out.
We have more news all the time on our website, ncpr.org. Music today by Dan Duggan of Lake Clear and Saranac Project of Saranac Lake. I'm Kara Chapman, North Country Public Radio.